a very important option which we got in recent years is Cenobamate. So, the drug has been licensed in Germany, for instance, around 2 years ago. So it is an available drug, but it's still the most recent one for the broad population of patients with focal drug-refractory epilepsy. Many persons call it a game changer in the treatment of focal epilepsies. The rates of seizure-free patients during the pivotal trials have been much higher than in the trials of other newer ASMs. In some terms, it's a difficult drug because it has pharmacokinetic interactions with other drugs. It has enzyme-inducing properties, and there are very special regulations for up-titration. So according to the principle of starting low or even very low in this case and up-titrating very slowly, because there have been around 2 or 3 cases of DRESS during the early pivotal trials. But anyway, in terms of efficacy, it seems to be a very good drug, and this has been proven during the pivotal trials and also in real life. On the other hand, going once again back to the pivotal trials of Cenobamate, we are talking about seizure freedom rates of around 20% during the very time-restricted period of double-blind treatment, which is high as compared to other drugs. But on the other hand, it means there are still 80% of patients who have not become seizure-free. So we are still in need of newer and even more efficacious anti-seizure medications. I'm happy that there are drugs in the pipeline. There are ongoing and planned prospective clinical trials with newer anti-seizure medications for the broad group of persons with focal epilepsy and also for the patients with DEEs.